Hello, my name is Jenny Johnson. Welcome to Mold Congress 2020. This is a Friday afternoon breakout session called Bridging the Gaps, Collaborating with Coaches to Enhance Care. Welcome. I thank you so much for being here and for your time. I so wish that we could be together live. I had planned this to be an hour-and-a-half long live breakout session in which we were going to sit together in a circle or even in small groups as clinicians, IEPs, patients, families, coaches, and really share what's going on in our practices and in our treatments, share what's going well, share what's going not so well, and collaborate on ideas for how we can bridge some of those gaps. I'm going to do my best to share the ways that I've gathered that information through surveys, through this presentation, this PowerPoint presentation. And there's something here for everyone, so please stick with it. There's going to be some great tips and strategies and resources for everybody, regardless of what your background is and what you're coming here for. There's something for each one of you. So thank you and welcome. And I'm going to stop my video now and share my screen so you can follow along with my PowerPoint. Bear with me here. Okay, so you should be seeing my home screen here, my title page, Bridging the Gaps, Collaborating with Coaches to Enhance Care. This is Patty Schmidt, and I have her as my first and foremost slide here because she is the pioneer of CIRS coaching. She has been serving CIRS clients and providers by working individually and in groups with folks struggling with CIRS as a health coach and as a psychotherapist since 2012. She has participated in the writing of Mold Warriors along with Dr. Richie Shoemaker, and she's been just a fantastic contributing member of the surviving mold community for so long. And she has recently announced her retirement and her movement into her next phase of her personal life. And we're so thrilled for her and so excited for her, but we will also miss her greatly in her service. So this talk is dedicated to her and her legacy and all of her wonderful work that she has done. This is me, and I'm going to share a bit about my professional background so that you have a better appreciation for where I'm coming from. My background is in biology and also in physical therapy. I have enjoyed almost 20 years of practice as a pediatric physical therapist. I transitioned into functional medicine after my personal journey with CIRS and have become a coach, a functional medicine certified coach through the Functional Medicine Coaching Academy, an affiliate of the IFM. I have recently become a national board certified health and wellness coach. I am also a Shoemaker Proficiency Partner diplomate through Surviving Mold. And I'm a Bredesen practitioner, and I'm currently practicing as a CIRS coach, a Bredesen coach, and what I call a salugenics coach, kind of 3 different coaching hats that I'm currently wearing. I'm going to share a bit about my personal journey with CIRS. I think most of us have one. All of you patients out there, I think it's important for you all to know that so many of the providers in this community are here because they have personally gone through CIRS or someone that they care about has. And we know very well what is involved in this journey and the loss and the transformation and the confusion. I'm going to share a little bit about my journey, but I don't want to spend too much time here because I want to get into the meat of today's talk. But it was about 10 years ago that my husband and I made the decision to move from the suburbs of Colorado to rural North Georgia to pursue what we called the grand experiment. We wanted to see if we could live off the land in a sustainable fashion and steward a micro ecosystem of bees and chickens and plants and water and be a part of it all and steward that and thrive from that. And it was beautiful. We had chickens and goats and an orchard and organic vegetables, and we learned so much. But one of the greatest things that we learned is that biotoxins rule homesteads, and they are a huge part of the circle of life. And they were a huge part of our downfall, actually, on our homestead and our ultimate return back to Colorado. It started with my husband, who had acute Lyme disease that was not turning around despite great treatment after 3 years. He had plateaued and was still on disability. Not long after that, my kids started a new school program that was being held in the basement of an old church that was undergoing renovation in a southeastern town. You can imagine what we encountered. My son got quite sick, and what I thought was interesting was that his symptoms really mirrored my husband's Lyme disease symptoms, but he didn't have a tick bite, and they started exactly on the first day of school at this new building. We were lucky enough to get in with actually his pediatrician had some background in sick building syndrome, and she identified his symptoms as being environmentally related. And long story short, this rabbit hole that we started going down together led us to the survivingmold.com website, where we started doing all of the labs and some testing on our home that was recommended on the website. Everything was off the charts for both my son and my husband. We went ahead and tested my daughter and myself and realized our whole family is in this genetically susceptible camp to CIRS. And all of us have some things going on that could be explained by biotoxin exposures. So we made the decision to have an hour-long consultation on the phone with Dr. Richie Shoemaker, and I am so very glad that we did. It was that time directly with Dr. Shoemaker that was really the turning point in feeling empowered and educated and hopeful that this was really real, and that was not very fun to realize, but that it was also treatable, and this is evidence-based, which I appreciated as a physical therapist. Except for our remediation, which we decided to try to do ourselves and learned a lot the hard way, we did everything that Dr. Shoemaker told us to do. We followed his recommendations and his guidance. We did ultimately leave and go back to Colorado because of our failed remediation. We ruined most of our belongings because we cross-contaminated everything by doing everything wrong. And it was pretty traumatic, honestly, to leave our lifestyle and to leave our things, to leave our beloved farm that we had built. But we were all sick and we wanted to get well and we were desperate. So we moved back to Colorado. We had better luck finding low ERMI homes there. And we landed in the office of a wonderful functional medicine practitioner who was open to trying the Shoemaker protocol. And we used Yvonne Berry's physician's reference for treating biotoxin illness. And it was a bit of the blind leading the blind, but her guide was wonderful. And our consultation with Dr. Shoemaker was wonderful. And it wasn't long before all four of us started feeling radically better and our lab started turning around after getting into a clean home and getting on the right binders. And I will add that our functional medicine practitioners' recommendations to pursue lifestyle modifications to optimize our recovery were really key. And I think especially for me, I had a lot of emotional, marital, spiritual, sleep issues, imperfect diet, stress, all of these things that really needed to be addressed before I believe I was able to fully recover and enjoy what I call resilience now. Despite having what is considered dreaded genes, our whole family now has enjoyed a resilient life for the last 4 years, not living in a bubble, though being vigilant. And I really dedicate that to the Shoemaker protocol and lifestyle salutogenic choices. And we'll be getting into that a little bit more in just a minute. So let's share the session objectives for our time together today. As a coach, I was trained to always start with the positive, and I love that. As a physical therapist and traditional medicine, we look right at the problem and how we can fix it, and there's nothing really wrong with that. That's okay too, but I've really enjoyed integrating positive psychology into my practice and starting with the positive energy. So we will start by acknowledging our successes. We'll follow that by exploring the current gaps in CIRS care. I will use a provider survey, a patient survey, and an IEP survey that I sent out to the Surviving Mold community and to patients across the globe to gather your input. And I will be sharing that information with you. We will consider the consequences if gaps are not bridged. We will identify the ways in which health coaches can help bridge gaps. We'll discuss collaborative models for integrating coaching that work. And finally, I will share some resources with you for accessing and implementing CIRS coaching, either into your practice or into your personal care if you're a patient. Okay, so before we move on, I want each of you to pause for just a moment, even grab a pen and a paper if you'd like, and just take a moment to ask yourself, what do you feel is going well with CIRS care? And similarly, what do you see as gaps or obstacles? What could be better? In the interest of time, I will go ahead. And again, we're going to start with the successes. And these are my opinions. These are what I see. I know this is not an exhaustive list of our successes. But I'd like to start here. One thing I want to point out is so many more practitioners are being trained to effectively treat CIRS. And that is so needed, so key, and just so fantastic. Similarly, more IEPs are being trained to effectively serve CIRS clients. We need this. We need more of this, and we are grateful that this area is being enhanced. Evidence-based care is being advanced by increased data collection and information sharing between practitioners. I love this, how surviving mold practitioners are sharing their data to enhance the database of evidence so that we can have more evidence-based treatment care. Research has been carefully collected and organized, further substantiating this illness and its diagnosis and treatment. I'm talking about old research, current research, some of Ming Dooley and Dr. McMahon's work. The Genie, need I say more? This is a fantastic tool based on transcriptomics that has so much promise even now and for the future that we certainly can celebrate as a success. Another success is that we still have VIP. I don't know what the current status is or what the status is of its future, but for now it is still available. And that is something worth celebrating because it was really threatened not long ago. And last but not least, Marcia, thank you so much. And everybody, Dr. McMahon, others who are involved in pulling off this virtual conference. When we found out it was going to have to shift gears a bit, we did it. And thank you so much. Okay, so now let's explore the gaps. I do want to say thank you to everybody who participated in my SurveyMonkey surveys. I utilized a survey from almost a year ago, a survey that I used for the 2019 Roswell Surviving Mold Conference for providers. And this was a survey in which I was investigating provider challenges, comparing newer providers to more seasoned providers. And I didn't want to bother the providers again with another survey of very similar nature. So I utilized the same information in the comments that were provided in that survey to inform this presentation. I also created a survey and sent it out to all of the surviving mold IEPs as well as the ICI IEPs. And I received 10 responses back, and I'm so grateful for the 10 of you who provided your feedback. I couldn't have done this without you. I created a SurveyMonkey survey for patients, and I sent this out to my clients and also to patients who are members of various Facebook groups. And I got so many responses, I actually had to cut it off at 100 because SurveyMonkey starts to charge you a lot extra after you go past 100. So I have 100 survey participants in the patient category who gave so much helpful information. And I want to say thank you to each and every one of you who participated. Without you, this presentation would not be nearly as interesting or as evidence-based. So we're going to start with the CIRS provider challenges. So the way this was designed, it was actually had 10 questions. One was kind of a qualifying question asking how long the providers had been treating CIRS. And then I proposed 9 challenges that I saw just in the surviving mold community. I saw in my own care and my clients' care, just being involved in the CIRS community. And I proposed these 9 challenges and asked the clinicians to rate their agreement with these 9 challenges one by one on a scale of 1 to 10. 1 being, no, I disagree completely. My experience has actually been the opposite. And 10 being, you hit the nail on the head. This exactly explains my situation. You'll actually see that I only have 8 on here, the 9th rated below a 5. So I didn't consider that a significant challenge. A 5 was really neither here nor there. I neither agree nor disagree with this statement. So let's start at the top and we're going to go through these. The number 1 top rated challenge, according to providers in this survey, with a score of 7.7 out of 10, psychosocial factors complicate patient progress. The examples of such psychosocial factors that I offered were poor adherence, unsupportive relationships, financial strain, emotional stress, poor coping strategies, decreased self-efficacy, history of trauma, fear, or hopelessness. I think this is really significant that a non-medical factor is number 1. Number 2, with a score of 7.5 out of 10, guiding patients in securing a clean environment is challenging. Another non-medical factor that doctors are carrying and bearing the burden of and trying to help their patients overcome is the environmental piece. Number 3, with a score of 7.4 out of 10, physiological factors complicate patient progress. Things like sensitivities, poor tolerance for binders, comorbidities, poor nutrition or hydration, insufficient sleep. I would add difficulty eradicating MARCoNS to that, or head injury or other infections such as Lyme or other co-infections. Number 4, with a score of 6.6 out of 10, patients do not have accurate information. Number 5, with a 6 out of 10 score, patients have unrealistic expectations for their recovery. Now that could be either too high or too low. Number 6, obtaining reliable labs is challenging. Number 7, with a 5.8 out of 10 score, the patient-provider relationship is strained due to trust issues and poor treatment from previous providers. And that can really be an obstacle to overcome. And last but not least, still with a 5.8 out of 10 score, patients require more time and attention than what I can reasonably handle. Most CIRS patients have a breadth of issues that are complicating their care, or that their care is impacting, chicken or the egg, right? And providers are doing a fantastic job shouldering all of those items, but it often does require a lot of time and attention that can be a heavy burden on providers, and we see that. So let's move into the challenges as seen by CIRS IEPs. And these are actually listed in no particular order. This survey was oriented a little bit differently, and I was going off of mostly their comments because I didn't know what their challenges were ahead of time to suggest them and have them rate them. So let's go through what they listed as their challenges. CIRS clients are financially limited since they are simultaneously facing medical bills, inspection, and remediation bills, and oftentimes lost income. So true. Sometimes they can't afford to fix their home properly, or they try shortcuts that end up making things worse. CIRS clients are often confused by conflicting information they come across. Yes, this is similar to what we saw in the provider survey about the misinformation. CIRS clients are somewhat more emotional than the general population. I think that's a nice way to put it, but yes, but the neuroinflammation combined with the stress and the overwhelm and often lack of support that we have does make us emotional. And I think the providers that we encounter feel that and see that. CIRS clients may have trouble remembering and following through due to cognitive problems or brain fog. Absolutely. Wow, that's a big one. Significant environmental sensitivities make some typical processes or products unavailable for CIRS clients. Absolutely, especially if we're talking about multiple chemical sensitivity on top of biotoxin sensitivity. CIRS clients are often too sick to clean their belongings on their own, and small particle remediations are costly. Yes, absolutely. CIRS patients are the ones who most often need this kind of a deep cleaning, and it is expensive to have a small particle remediation done. And the general population might be able to do that themselves and not really worry about getting sick. But CIRS patients are either too sensitive to do it or just too sick and too fatigued to do it themselves, and that's another cost. CIRS clients require almost twice the time for inspections and follow-up consults due to complexities. I think that's great to be aware of, that yes, our needs are more complex and that does require more time, and that means more money as well. And last but not least, spouses. Need I say more? This is an emotionally charged and a financially charged situation. And oftentimes spouses can come in and have a lot of questions and present themselves maybe even as obstacles. Okay, so now we're going to talk about the patient challenges according to the SurveyMonkey survey that I conducted with CIRS patients. I did on this survey, I had a qualifying question at the top, making sure that patients had been diagnosed with CIRS and were in treatment with a CIRS-aware practitioner. I also separated patients into categories, one being I was diagnosed with CIRS, I am seeing a CIRS-aware practitioner, and I would consider myself 80% recovered or more. And another category was I've been diagnosed with CIRS, I'm seeing a CIRS-aware practitioner, and it's been 2 years or more, and I have seen little to no progress. There were several other categories, but I found it really interesting to compare the answers between the folks who had recovered for the most part and those who had not. And we'll be getting into that a little bit. One thing that was interesting is regardless of which category, they all agreed on number one with a 9.5 out of 10 score. This is astounding. The financial demands of navigating CIRS are challenging. Straight across the board, all categories of patients, this was the same rating. Number two, with a score of 8.7 out of 10, staying organized, focused, and on track with treatment is challenging. Yes, absolutely. I'm actually surprised that one came out as high as it did, but this is huge. And guys, this is low-hanging fruit. Number three, with a score of 8.6 out of 10, navigating decisions about living environments and belongings has been challenging. So not just acquiring a low ERMI home or successfully remediating a home, but even just navigating the decisions because of whether it's overwhelming information, lack of information, too much information, confusing information. This is a really hard area to navigate. Number four, I have had challenges to my identity, spirituality, purpose, and meaning in life. Wow. Number five, maintaining hope and belief that I will recover from CIRS has been a challenge for me. Number six, insufficient emotional support, community, and validation have been challenging for me. This one is huge. I actually thought this one would be a little bit higher. Number seven, accessing helpful information and resources about CIRS has been a challenge for me. This is one that we saw all across the board between providers, IEPs, and now patients. Number eight, accessing a practitioner who treats CIRS has been a challenge. I am so glad that this one is an 8 and not a 1. This highlights that we are making progress in the area of CIRS training for providers. although it is still a 7.7 out of 10. So these are all extremely highly rated. So even though there are more practitioners, not everybody can access them. I would say the majority of people who identify as having CIRS are not seeing a shoemaker doctor, do not have access to a doctor who knows how to treat them well. There are so many people struggling on their own. Number 9, navigating accommodations or complaints with with employers, builders, landlords, or schools has been challenging for me. So what I'm going to do is I'm going to attempt to summarize the gaps as presented by the 3 different categories. The first summary, the first kind of category, I guess, of obstacles that I've identified by looking at everybody's opinion here is finances. The cost of effective medical and environmental treatments are either prohibitive or they're devastating, one or the other. For those who can't afford it, it is truly just a lock to access. And this is a huge issue. For those who can't really afford it, but can cash in their 401k, their retirement plans, they can borrow money from family members, they can redirect funding from college accounts for their kids. They can maybe pull this off, but it is still incredibly stressful and devastating and has long-term effects on people's future finances, especially when these things are combined with losses of income and loss of belongings. The financial obstacles are devastating. The psychosocial mediators of illness. I feel really strongly about this one. This is a big one in my personal experience. Insufficient emotional support, fear, stress, overwhelm, poor coping, hopelessness. These things not only decrease our subjective well-being, but they enhance our sympathetic dominance. They add insult to injury by impeding our digestion, our detox, our immune system, even our sleep and our executive functioning. So that they are adding insult to injury. These are the systems that we need to be online more than ever to recover. And these are being indirectly affected by our response to our illness and creating a cycle that is so hard to get out of. I see this almost like patients have a biofilm around them that is preventing quality treatments from entering in and taking root and actually having effect. We have this border around us, this stress response, the sympathetic dominance that needs to be cultivated and pierced and healed so that we can optimize our healing and optimize our treatment and our ability to uptake all that the providers are offering for us to heal us. Environmental challenges. Finding and maintaining a low ERMI home is often not feasible. And often this comes back to finances, the feasible part. It is such a challenge to stay in a clean home. And I think that this begs a question of possibly a root cause for all of this. Our building materials, building standards, indoor air quality standards. Where are the advances? I hope somebody is on the front lines of this, and I would love to be a part of a committee if there's not one yet, but we need for our grandchildren, great-grandchildren, to not have buildings that are so conducive to water damage, where we're not running from home to home to home or calling remediators every 6 months to fix a problem. How about fixing the structure of our homes and the materials of our homes so that we don't have to keep perpetuating this run? Challenges with follow through. So here we have brain fog, memory problems, pain, fatigue, and overwhelm, making it challenging for patients to stay on track with both their environmental and their medical treatment plans. We heard this from IEPs and from providers. Are providers and staff at risk for burnout and excessive time required to support patient adherence between appointments? This was the number two top rated challenge for patients, that they did not have the wherewithal to keep it all together. Now, there's neuroinflammation that's a part of it that impacts our executive functioning directly. And then there's the overwhelm, the loneliness, the fear, the limbic system that come in and demolish whatever is left of our brain. And it is so hard to organize the timing of our binders, all the different phone calls we need to make to coordinate our remediation, to remember what to ask our practitioner at the next appointment. How many times do I take my Marcon spray? All of it can be just so overwhelming. And then we have physiological complications, chemical sensitivities, poor tolerance for binders, comorbidities, difficulty eradicating Marcons, hormone imbalances, additional infections or toxic exposures, brain injury, or a weakened constitution, potentially due to lifestyle habits. And again, here I'm talking about almost like the biofilm or the poorly cultivated soil that makes it so that these wonderful treatments, the protocol, the binders, the nutrients, the supplements are less able to take root because we are not digesting properly. We are not detoxing well. We are not even eating well, sleeping well, managing our stress well, and our emotions well. And that can have physiological complications, physiological feedback. We have an information gap, and this was another one that we saw across the board. Providers, IEPs, and patients all agreed: resources, education, information, there's something amiss. Patients often do not get adequate, timely, and reliable education about medical and environmental considerations that are needed to prevent many of the obstacles that we just discussed. And this leads to undue loss and suffering and secondary complications, delayed recovery perhaps, that could have been prevented if patients had the right information up front to make the right decisions and get the right help. So, what are the consequences if we fail to bridge these gaps? I thought this picture was funny, and I thought it would be pretty mean if I had somebody dangling off the bridge, which is the reality perhaps of this question, the real answer. So I put its opposite here, although probably not, sailing across the juncture. These are actually some of the quotes that were offered in the comment section of the survey that I received from patients not long ago. And I did not have to dig very far to pull these up. There were quite a few sentiments. They were just pouring in from these hundreds of patients. And I'm going to share just a few of them with you because I believe that they deserve to be heard. And again, these are consequences when gaps are not bridged. It leaves individuals in desperate and vulnerable positions, almost impossible to live in this world. It is a daily struggle, often with bouts of crying, because you feel so hopeless that you'll ever get better. This is one of the most overwhelming illnesses, and you have to fight for your life when you feel like you are dying a slow and painful death. I've never experienced anything like it in my life. Nobody believes us. This contributes to the depression that people feel. We need financial and emotional support. It's incredible, beyond words. I've had to be my own doctor, researcher, detective, advocate, and support system. And now my son has all of it. So many intensely difficult years of this, and I'm exhausted mentally, physically, emotionally, and spiritually, and bedridden, and it all feels impossible. I have one pair of shoes and a few pieces of clothes. Lost everything. I feel so trapped and isolated with so many water-damaged buildings and lack of public awareness and support. It's extremely difficult to engage in life in a typical manner. After getting CIRS, I feel like my opportunities to work and to socially participate in life are extremely limited. There's so very little I can safely do without reacting. I'm single and life is very lonely and without purpose when one has CIRS. I have made countless spreadsheets and checklists to try to stay on track, and I still find it challenging Because of CIRS, my energy levels and brain fog and concentration vary daily, which make it extra hard to stay focused and stick with a plan. I've lost my finances, my friends, and my freedom. I can understand why some don't make it out of this mess alive without support from others. That's when I became suicidal. That was the patient perspective. And I'm not sure what the providers are feeling. I know that many of you have huge hearts and you are shouldering a heavy load by yourself, and you're doing it really, really well. But I fear that you may be at risk for burnout, or your staff, from trying to cover so many bases and so many aspects of CIRS care that extend beyond that which requires a medical license. So let's look at this a different way. Let's look at the correlates of positive outcomes. So I explained before that in the patient survey, I had several categories. One was patients who were 80% recovered after about 2 years of treatment with a CIRS-aware practitioner, and others who had the same care, same length of treatment, and felt that they were had made little to no recovery. How did they answer these questions differently on the survey? There were 4 that jumped out as a greater than 5% difference between these two categories, and I'm going to share them with you here. Number 1, with a 32% difference in subjective ratings between these two categories of patients, is hope. Now, I don't know if some patients had low hope in the beginning, and that is why they didn't recover, or if after 2 years of treatment, their hope dropped. But I think we all agree that hope is a pretty important ingredient to our success. And when hope drops, the chances for success go with it. And so we need to do everything we can to keep that hope as high as we can, as realistic as possible, but also high. Number 2, with a 24% difference in subjective ratings between these two categories of patients, success navigating decisions regarding their environment. We know this. We have known that when patients get into a clean environment and can make that decision quickly and confidently, their success is so much greater, or maybe not greater, but quicker. That is the foundation of the Shoemaker protocol. And those who successfully navigate that decision early are going to have better success. With a 21% difference, we have this one, access to helpful information. Wow, now that's something that we can do something about. For people who improved to 80% compared to those who made little recovery, this was a huge gap. This was a huge difference in these two populations, and we can do something here. There was also a significant difference in this area. Success staying organized and on track with recommendations. Wow, that's another piece of low-hanging fruit that we can enter in and do something about, to put people in the category of recovered versus the category of little recovery. So let's talk about what coaches are and how they can help bridge gaps and enhance positive outcomes. Whoops. I don't know how to go back to that slide. Well, maybe it wasn't meant to be, but I'm going to try to explain in the future slides what coaches are. But what I wanted to maybe explain from the previous slide that I don't want to take time trying to figure out how to get back to is there's a difference between a certified coach and someone who calls themselves a coach but has not been through a training program or a certification program. The term coach is not regulated, and it can be used by anybody. And most people are well-meaning and they're trying to help people, and that is wonderful. But a certified coach is someone who has actually gone through a coaching certification program. Some of them are only a weekend long. Some of them might be a month long, 3 months long, 6 months long, a year long, or even a bachelor's degree. So they really vary in their length and in their breadth. The program that I went to was called the Functional Medicine Coaching Academy. This was an excellent program that was 12 months long. It's an affiliate of the Institute for Functional Medicine, and it went really deep into the aspects of functional medicine that are going to help a coach integrate well with functional medicine providers, but also quite a bit of behavioral psychology. I will explain that coaches are not content experts unless they have an additional certification or an additional training in something else that is a content expert, that is gives them expert status in a content area, such as nutrition. Or for me, I'm also a physical therapist. For Patty Schmidt, she's also a psychotherapist. But for someone, for general coaches, they are not content experts. They are process experts. We are behavior modification specialists. We are motivation specialists. We are getter-doners. There is something called the National Board for Health and Wellness Coaches. And this is really the gold standard for coaches. So if you want to look into coaching for yourself, or you're curious about collaborating with a coach, looking for that National Board certification of health and wellness coaching, NBCHWC, are the letters after somebody's name, indicating that they have gone as far as possible in their coaching training and certification and accreditation. Okay, so let's get into what coaches are. Coaches are empowerers. Coaches are trained to see strengths and potential in others, drawing awareness to possibilities. Coaches empower clients to acquire a healing mindset based on self-efficacy, hope, and I highlighted that because it correlates with the previous slide, how important hope is, inner resources, personal agency, and I will add past successes, and an illness narrative that supports progress. Coaches are also liaisons, and especially in this CIRS world, we can really be powerful as a glue between patients, their clinician, and their environmental specialist to enhance the communications between all parties and help the patient follow through with the recommendations from the experts on both sides. Coaches are patient educators. I have a picture here of the recovery manual for patients and families impacted by CIRS, which is an incredible resource and manual for patient education programs. I'm going to be talking about a patient education program that has already been designed in a future slide. But CIRS coaches can also be educators, and we can use manuals like these and go through them with groups of patients or even one-on-one with patients to help make sure they acquire all of the information from the get-go that they need to avoid costly mistakes and to optimize their success. Coaches are change agents and organizers. We are experts in behavior change and in intrinsic motivation. We are experts in helping patients summon their personal strengths and values to overcome challenges. Coaches support patients in breaking large goals into bite-sized pieces and staying organized with their daily, weekly, and monthly to-do list. We teach patients how to time their binders, how to track their symptoms, how to log their progress, and how to creatively manage obstacles that arise and when to call their provider if they have questions. I love this one. Coaches are cultivators. Again, coming back to this image of cultivated versus uncultivated soil. This is something that I learned when I was on the farmstead, that our soil is so important. We realized at the beginning of our homesteading experiment that we didn't have soil, we had dirt, and we had to cultivate that dirt and add a lot to it and dig it up and work with it quite a bit before it was going to be ready to bear any fruit. And I wonder the same with our bodies and our minds when it comes to recovery and resilience. Some of the cultivators that I'm talking about are nutritional support, restorative sleep, exercise and movement, stress optimization. And I don't necessarily say stress minimization or stress management, while those can be important, but sometimes stress can be our friend, and learning how to optimize it. Low toxin living, a positive mindset. This is probably one of the hugest. Supportive community and spiritual connection are all things that cultivate the soil so that we can receive the protocol. Coaches are facilitators. While we are not mental health practitioners per se, unless you're trained in psychotherapy like Patty, but we are trained to support clients who do not have a psychiatric diagnosis to work through the emotional content that is associated with their healing journey, using unconditional positive regard, empathy, active listening, and positive psychology techniques. Coaches can also facilitate support groups for clients to share experiences with others who get it. And this is something that I offer virtually, and I have seen as a huge hit. Something that so many CIRS patients want is connection with others who know what they're talking about and have gone through something similar. They all feel like they're the only ones that they know who's going through this. And there's so many of us. It's just that it's not being talked about like other illnesses that have a great community awareness about them. CIRS just isn't quite there. And so we need each other, whether they're in one provider's practice, having a group session of some kind there, or connecting virtually. That mutual connection with others who understand is so healing. Lastly, coaches are optimizers. I love this one too. This is a diagram of Maslow's hierarchy of needs. And what this depicts is how the base of our pyramid is very important. And this is our safety environmentally, and our physical wellness, and our safety and our healing physically with our treatment. But when we come in and add in the psychological piece, the emotional piece, the mutual community support piece, and we start to move up this pyramid and start to make progress, what happens when you add in coaching? I would say this is the coaching piece on top of the environmental and the medical piece. When a client gets to go through this, they often have gained the momentum and the excitement and the self-discovery, the personal growth that makes them want to keep going. And oftentimes we see what I call post-traumatic growth through an experience of suffering. And I would consider CIRS to be an experience of suffering for many of us. Because of this process, this upward momentum of growth and of change and of transformation in a positive way that is possible. And it is one of my favorite things to cultivate that possibility of positive transformation for my clients who are open to that. I like this quote by St. John Paul II, "Don't waste your suffering." Okay, so you're probably thinking, great, I like this. How do I know which patients might benefit the most from coaching? Who do I send to a coach? Honestly, I would say everybody. I don't know who wouldn't benefit from coaching, but this list gives you an example of who might benefit the most. The way my screen is organized, I can't see the top line very well. I think it's discussing people who could use some help staying organized and on track with their medical and environmental recommendations. Absolutely, that category of patient could benefit from coaching. Patients who feel alone and isolated and who desire community and validation, whether they're working one-on-one with a coach to work through emotional content or working in a group, patients who are feeling alone could really value or really benefit from coaching. Patients who are highly motivated and they just desire some accountability, that is super fun to work with this population as a coach. On the opposite side of the coin, those who have little motivation and need some hope. They need some success stories to spark their desire, their ability to even put one foot in front of the other, to find their own motivation. Patients who are in sympathetic dominance, which may be impeding their recovery. Yes. patients with lifestyle habits that may need to be modified to support full recovery and resilience. Patients who want to make the most of this suffering and seek positive growth and self-discovery through it. We say that CIRS is a multi-systemic illness, and it is. And I want to posit that it is beyond multi-systemic and actually multi-dimensional, that it not only impacts our physiology, our physical body, our entire body, but it impacts us socially, environmentally, economically, psychologically, and I would add in spiritually. And I'm sure there's spheres that I'm even forgetting about, but I love how they overlap because that is reality. And that core, that Venn diagram core, is our well-being. And I don't know that we can truly achieve true wellness unless we are addressing all aspects of our person. So let's discuss some collaborative models for whole person care that work. Number one, you might consider hiring an in-house CIRS coach if you have a practice with many CIRS patients. Hiring a dedicated, trained CIRS coach can streamline care, delineate staff roles, and free up practitioner time to see more patients. CIRS coaches can run systematic patient education groups for all patients from the get-go, making sure important considerations do not fall through the cracks and providing that healing sense of community. CIRS coaches can follow up with all of your patients between appointments, making sure they're able to follow through with the recommendations. They can help your patients troubleshoot obstacles, and they can document directly in your EMR. For patients who desire more in-depth or customized support, coaches may provide ongoing private sessions with them as needed. Another option for you might be to consider independent contracting with a CIRS coach. Now, this might be a great option for practitioners who don't wish to hire a full-time coach for their practice, but they like the idea of having a formal relationship with an independent coach who can serve their patients in a way that they've decided upon in advance. A CIRS coach working in this capacity could actually offer the same exact services as an employed coach. Though, here are the differences. They may be part-time instead of full-time. They may be out of state instead of local. They can work virtually. With patient consent, they could still communicate directly with you and with the IEP and be that liaison and document directly into your EMR from wherever they are virtually. So a CIRS coach working in this capacity could also do group services virtually. They could do one-on-one services. They could do those between session calls, those follow-up sessions to check in on patients. They would just do this from their own location or from their home virtually. And they might also be contracting with other medical offices or have their own private clients as well. A third option might be to refer to an independent CIRS coach. And this model is great for practitioners who don't wish to build CIRS coaching into their business model or their practice model, but they like the idea of having a coach to refer their patients to as needed and allowing their patients to pay and choose the type, frequency, and duration of coaching that they want. So independent coaches like myself often work virtually, so we can serve patients privately or in group settings by phone or by video from anywhere in the world. And what's pretty cool about this is that patients don't have to travel. So if they're not feeling well or they're unsure about being in buildings they're not familiar with, they can be served from the comfort of their own home. In this model, there are also no officing or administrative requirements for providers. All of the scheduling, billing, everything, officing, paperwork, it's all taken care of privately between the coach and the patient. Now, patient consent forms can still allow the coach, the provider, and the IEP to communicate as needed. Sometimes the coach in this state can even still document in your EMR, or they might send you maybe a monthly summary, or could talk to you on the phone about the patients that you're collaborating on, again, in a decided upon manner between the coach and the provider. Independent coaches like myself often have done for you patient education programs. So if you don't want to reinvent the wheel and develop a program for your own office, you can send your patients to a coach who already has a virtual program set up, knowing that they're going to get this quality education. Same thing with support groups. Here are some additional considerations when looking for a CIRS coach. We talked about this a bit, certified versus non-certified. If you hire a coach who is not certified, that means they did not receive coach training. So they might be a wonderful person, they might have background in other things, but they wouldn't be training in the behavior, or they wouldn't have received training in the behavioral psychology techniques involved with developing intrinsic motivation, goal setting, motivational interviewing, active listening, some of the skills that certified coaches are trained in. And then again, there's the kind of gold standard national board certified health and wellness coaches, which is one step beyond just regular certification that you went to a program to achieve. The CIRS coaching niche begs enhanced training and experience. And this is not something that is formally available right now, but is in the works actually. And I would just say that if you're going to hire a coach or collaborate with a coach to serve your CIRS clients, it would definitely be advantageous for them to have had some personal experience with CIRS and some kind of advanced training or association with a professional group. And then we've talked about this before as well. Some coaches have additional trainings or licenses or certifications in areas that may be desirable for you if you are a provider or a patient and you want to look for a coach who's also a nutritionist or also a physical therapist, a functional medicine practitioner, a mental health practitioner, does massage therapy, yoga, is also a nurse. A lot of coaches also carry other licenses, and you can really kind of pick and choose your ideal candidate. This is a flyer for the virtual community group that I offer. And I really don't want this to be an infomercial for me and for my services, but I feel like I would be doing a disservice to the group if I did not share something that I feel so strongly about as an incredible value and an incredible opportunity and asset to bridge so many gaps in one program. This is a 10-week program of systematic patient education. I use the Surviving and Thriving manual as a guide, and I invite in professional guest speakers from the Surviving Mold Practitioner Board, in addition to an environmental specialist involved with surviving mold, so that the group participants are getting medical and environmental questions answered directly from the experts within the group setting. We have 8 additional sessions that are based on optimizing their recovery, utilizing mindset strategies, lifestyle enhancements, and then just sharing tips, resources, successes, stories, and enhancing that validation and that emotional support that is so healing. I'm going to share a little bit about another program. This has been developed by Lori Rossi, and her contact information is on the slide if you would like to contact her about the patient education program that she has created for CIRS practitioners. And she's put a lot of blood, sweat, and tears and heart, I would say, into this program that can be integrated into your practice. So if you see a lot of CIRS patients and you would like to have one of your staff members who may or may not be a coach, but who wants to provide the systematic step-by-step patient education utilizing this manual, I encourage you to reach out to Lori and ask her about the program that she has developed that is just so thorough and so helpful. I told you that I would offer you some resources for collaborating with a CIRS coach. First and foremost, you all are welcome to contact me directly if you want to know more about how to work with me or how to find a coach in your area. Right now, there is not a database of CIRS coaches. We're actually working on an association or a consortium of some kind to put this in place for you. But for now, feel free to reach out to me. I'm very well connected with certified coaches, most of them functional medicine certified coaches who have a niche in CIRS care due to their personal experience and enhanced trainings. And if you are looking for someone in your area, I might be able to hook you up with somebody who is well qualified. So feel free to reach out to me. My email address is here. Also, Laura at Glass Full Coaching, I have her email address here. She is a functional medicine certified health coach, in addition to a national board certified health and wellness coach who also has a business background. And her passion is in helping functional medicine practitioners and CIRS providers in optimizing their staffing and their practice model to streamline care and to integrate coaches if desired to really optimize the delineation of roles. And so if that is something that you are interested in and feel that you could benefit from, I encourage you to reach out to Laura. I also have two different listings on the bottom here for websites. The National Board of Health and Wellness Coaching.org website offers a directory of national board certified coaches. And the Functional Medicine Coaching Academy also offers a website with a Find a Coach service. And you can look for a coach in your area, and oftentimes coaches will list their niches. And so you could look for someone with a specialty in environmentally acquired illness, CIRS, Bredesen, whatever it is that you were really wanting, and see what you can find there. That brings us to the end of our presentation, and I thank you so much for sticking with me. I hope you enjoyed the content, and I hope you enjoy the rest of the conference. I encourage you to reach out. I would love to know your feedback. I would love to know your questions. I would love to know what's going well for you and in your practice or in your treatment or in your care and what you're struggling with. I would love to be a part of making CIRS care as optimized as possible. Thank you so much for your time. I do have a few slides that are following here, and you have access to all of my slides if you were interested in learning more about what the literature has to say about health and wellness coaching, and does it really optimize outcomes. And I think you will find from the literature search that the evidence says that it does. And I find that really encouraging, and I hope that you do as well. Enjoy the rest of your conference, and thank you again for your time.